certain Monday and give the process how it is going to be. It just went quiet like that, only to come and hear that employment has started.
Yes, could you mention that, because it's only 2 days ago when the PS actually said that recruitment of 11,200 health workers have commenced, but it has started from the drawing board to ensure that it is done flawlessly and methodical. But if you're going to have such statements, from the minister, what do you make of such statements, really, if it's not really true that this process has begun, yet the Home Minister says that the process has begun?
The biggest problem we are having is politicizing employment resource. But their industry has got too many problems, and employment is just one of them. We have shortages of human resource, but there are bigger problems. Now, we've prioritized, and we always talk about employment. Employment is something we're supposed to talk about once and plan time. But what has been done to advertise on such and such a day? That's how you manage people, and nobody will be anxious about it. They'll wait for that time. But what has been happening is every news you hear about employment and volunteers. Employment and volunteers. So people are thinking every day, what are we going to hear about employment today? Then the other day you hear employment already started. But we were not told. Only to come and hear, no, I didn't mean it started, but we've just started planning. Then you hear, no, 1,000 people have already been employed. Then people are coming with letters. Even now, normal things like replacements are seeming like they are not normal. But replacements have been going.
Can I understand one thing? Is it,
being promoted, and we've got people who are leaving the ministry to join organizations.
Can I understand one thing? Is it so that the delay in employing these health workers is not the biggest problem, but the biggest problem you are currently facing is the criteria in which these people are going to be chosen?
There are two issues here. One, there's confusion, and there has been a lot of contradictory statements coming from the Ministry of Health. We don't have a clear path about employment so far.
In terms of when it's going to be done, or what do you mean when you say you don't have a clear path?
Process, timing, all those things are not there. We'll give an example. Last year in somewhere October, they said they were going to extend the contracts for those doctors who are on contract up to 31st December. And those contracts were not going to be renewed because January they were going to have permanent employment. When January came, they started having talks with World Bank to try and, extend the contracts up to April. Those were the talks. So we went to ask, look, you are supposed to employ these people on permanent basis. Why then are you going to talk with World Bank to try and give them contracts? Then there were no answers. We now heard, no, employment will start this January. And the minister was saying that. But in the background, again, the talks were ongoing with World Bank to extend the contracts. That is just one side. And we have those who were with WHO, which is World Health Organization. They were supposed to renew, but for them, they didn't renew. It ended like that. So we hoped that, okay, since it has ended, we hope that even World Bank is not going to renew so that these people can be on permanent employment. It hasn't been done. And the entire January has been full of statements, but no movement in terms of what is supposed to be done. So that is one aspect. The other aspect we need to remember is that I'll give an example of the doctors. The doctors, when they work for 1 year, 6 months, they finish their internship if they trained in Zambia. And then for those who trained abroad, they will need to take 2 years. When they are done, they are supposed to be now promoted as senior resident medical officers, which means they will now move from that station of internship. They will be sent in rural areas or another place. That has happened because from the time they employed, those people have finished. So now those people have been sent, they have been posted. So the hospitals are now languishing because they don't have interns. And that has brought shortage. When people go to hospital, they'll go and complain of queues and all those things. So in as much as we are talking about employing people, we are fighting for the patient. Because it's you and I, when we go to the hospitals, that we want to find a healthcare worker there. We have a lot of facilities in rural areas. We are running after achieving the universal health coverage by 2030. Now that universal health coverage, we can't achieve that without primary health care. That primary health care, we are talking about the facilities, those clinics and small hospitals, those which are in the rural areas. If you go in those rural areas, you will find the entire district, maybe there's just one doctor. If you go to a facility, you find there is no nurse, there is no clinic officer. You may just find a community health assistant. And those are the people who are delivering people. They are people who are doing everything. So when we formed this consortium, we realized that no one profession is important than the other, because no doctor can function alone, no nurse can function alone, no pharmacist can work alone, no clinic officer can work alone. So if we are to solve the problems, we need to do it with concerted efforts, and we need to do it as a team, because it's a team even when you go to the hospital which attends to you. So we feel this employment of all these cadres